Hello everyone, my name is Sam Owusu, a graduate student in Health Informatics at George Mason University. This presentation is part of HAP 725 Statistical Processing Improvement course taught by Dr. Farouk Alemi. In the following slides, I will be comparing the performance of University of Virginia Medical Center Charlottesville versus its competitors. The data for this analysis was obtained from Center for Medicare and Medicaid Services Hospital Compare database. The retrieved data was from September 1st, 2014 to September 1st, 2021. Limitations of the data sets. 1. Unavailable data. The data sets were missing values for some of the hospitals in certain years. This may have effect on the overall analysis of comparing the hospital performance. The second limitation was the gaps or missing date range in the data sets. This slide shows University of Virginia's Medical Center, Charlottesville, and its regional competitors, Roanoke Memorial Hospital, Mary Washington Hospital, Henrico Doctors Hospital, and Sentara Norfolk General Hospital. I will be comparing the performance of UVA versus its competitors using the following measures: hospital-acquired pressure sores, incidence of serious blood clots after surgery, post-operative bloodstream infection, accidental cut and tear from treatments, and overall patient satisfaction for these hospitals. For the remaining slides, I will be using control charts to depict variations in performance between UVA and its competitors. The blue line on the chart will represent UVA performance over time, and the red lines is the control limits. X-axis will represent time period in years, and the Y-axis will represent the scores. The first performance indicator to compare is hospital-acquired pressure sores. The control chart here compare UVA Charlottesville incidence of pressure sores versus its competitors. The blue line indicates the average pressure sores recorded at UVA. From 2015 to 2017, UVA rate of pressure sores was within the control limit and trended upwards. In 2018 and 19, UVA's pressure sores indicator was above the upper control limits, but fell within the control limits in 2020. The second performance indicator is serious blood clots after surgery. UVA performance, the blue line, declined throughout the entire period, but stayed within the control limits. The third performance measure is bloodstream infection after surgery. UVA's infection rate was at the same level as the upper control limit at the beginning of the period 2015. However, it increased significantly in 2016 past the upper control limit. The rate of infection declines and remained within the control limits for the rest of the period 2017 to 2020. The fourth performance indicator is accidental cut and tear from medical treatment. Here, UVA's performance was within the control limits for the years 2016 and 2020, but the score was at the same level as the lower control limits in 2015 and from 2017 to 2019. The final performance indicator is overall hospital ratings by patients. UVA scores was within the control limits for the years 2014 to 2016, 2019, and 2021. However, UVA's rate was above the upper control limit for the years 2017 to 2018 and 2020. In summary, the reported indicator, serious postoperative blood clots at UVA, was within expectation since the trend was within the control limit. However, the hospital's rate of pressure sores was worse than its competitors in 2017 and 2018. UVA's bloodstream infection after surgery was also worse than its competitors in 2016, but it improved to normal levels from 2017 to 2020. For the accidental cut and tear indicator, UVA's performance was within the control limits for the years 2016 and 2020, but was at the same level as its competitors at the lower control limits in 2015, 2017, and 2019. Finally, UVA's overall ratings by patients were within control limits from 2014 to 2016 and 2019 and 2021, but the hospitals outperformed its competitors in 2017 and 2018. Thank you.